Arlene traveled from Canada to Lithuania for a rare double partial knee replacement operation.
I was all prepped, and the day of my surgery, they gave me an ECG and determined that I had atrial fibrillation.
And we had a consult with the cardiologist and anesthesia guys. It was taken that it was too much of a risk to do surgery on her because she has both knees that should be operated on.
I couldn't believe it. I said, has anyone ever gone home without having surgery before? And they're like, yeah, no.
Now she's back in Lithuania and is anxiously waiting for the anesthesiologist, who has her latest ECG results. Will Arlene end up being sent back to Canada twice? And if the anesthesiologist gives her the go-ahead for the double partial knee replacement surgery, how will it turn out?
I know that you had some troubles in the past, arrhythmia probably. Now we have slight abnormalities, but it's not contraindicated to have a surgery today and anesthesia.
Okay, good. Okay.
So everything is okay.
Okay, perfect.
The main question is answered. Now you can calm down.
Yes.
Do you remember what we have talked about?
Yeah.
So everything is quite the same. The x-rays are done. Not a lot of changes that was previously. Short time of period and it did not get more severe. I just want to see that it still goes back to its alignment, like try to relax completely. And no, I'm not doing anything.
Okay, all right.
So we can proceed with a uni.
Okay.
It's unicompartmental replacement. And the thing is, we just take it off the surfaces of the medial side. Mm-hmm. We put this implant in, and then we put a bearing that will act like as a meniscus. It's a mobile bearing, so it pops in, and it's just working like your knee was before.
Okay, awesome.
The thing is, you have to have all the ligaments and no disease in other compartments, otherwise it won't work and give you the effect that you want.
Okay.
But again, your age, your x-rays, how you're feeling and how the disease went, it looks like you're a good candidate for the unicompartmental.
Okay.
If you would need, it's not common. Sometimes we need to convert to total knee. Maybe after some time, maybe something happens, or in some cases, we can incorporate the same incision and go upwards, and it does not mess up with the future plans if you need one.
Okay.
It means, again, you're young, you're active, so a lot of things can happen in your life, and you still have the probability of revision surgery. Mm-hmm. And this is why we try to incorporate the skin incision and make it so that in the future, if you need additional surgeries, they can just get through it and not make any problems with the soft tissues.
Okay.
Have you noticed the Canadian hat?
Wow, that's very
Nope.
cool.
Yeah.
Handmade from one
Yeah.
of Dr. Linus's patients from Canada.
Aww.
And inside
nice.
it has his name written. So
Yeah.
it's here.
Yeah.
Here it is.
Oh my God.
So she
So-
handmade it, and we went to Canada.
Just to take it back, just for the hat.
Yeah, just for the hat. I was there for the
You,
hat.
was that at the barbecue?
Yeah.
Yes, yeah.
Yeah. Good morning.
Morning.
Is it a good one?
No.
No. It's because of the pain, the jet lag.
I don't know. It just seems like everything caught up to me.
The thing is, because during the surgery you still lose some blood. It's not a lot because your hemoglobin level is good, so we don't need any transfusions and so on. But because you get anesthesia, because you have a bit of blood loss, because you have pain, so all of that connects, and sometimes patients get like hypotensive in the first days. So this is very crucial for you not to be like keen on speed. You have to do everything slowly.
Everything very slowly.
Sit for some time, see if everything's good. You're not like head spinning, no dizziness and everything else. So you can stand up, stand a bit, and then try to walk around. Just relax. Relax. Like again.
I actually remember this back from May.
So So does it feel awful? Relax all the muscles and try not to keep tension on them. Because when you keep tension, you're always tense, so this is when you feel more pain.
This is easy. I can do this.
Yeah.
I might
So-
even be able to sleep like this.
Nope.
This is very comfortable. You're right, it isn't all sunshine and fairies. It was very hard. I was very sick one day. I had no energy. Physiotherapy is critical. It's a huge component of this recovery. I'm discharged in 3 days, and I'm amazed at how far I've come. 8 days past my surgery date. It's very doable to not have someone here with you. The rehab is in-house, which really appealed to me, because if I had to take an Uber back and forth every day from the clinic to another building to have rehab, I just didn't want to do that. This just made way more sense to me to keep it in-house. You just have to get in the elevator, go down a couple floors, walk down a hallway, and there's your rehab. So. Bye, Lithuania. Sorry I didn't get to see very much of you, but came for the surgery, and now I get to go home. Very happy.
It's a great visit, and I'm so happy with my new knees, and I would do it all over again. Yeah, I'm excited to be home, but I'm a little bit sad to leave. Such wonderful people. I hope to see them again, maybe at the Calgary Stampede. Bye. New hair, new glasses to go with my new knees. When I came back home, I found that I only had to really stay on the medication for maybe a week. And then the pain lessened quite considerably.
When you went to see Dr. Miller for two weeks follow-up,
Right.
he sent me a picture of you sitting on the chair, and then your knees were bent the same as they are today.
He looked at me and he said, "Is that comfortable?" And he pointed to my legs, and I said, "Yes." And he goes, "Oh my goodness, you shouldn't really be doing that movement at so early post-surgery." So he said, "Can I take a picture?" And I said, "Sure." So he was quite pleased that I had that range of motion in my knees. I talk about Lithuania all the time and what an amazing experience it was. And in a few years, if my hips start to go, then I know where to go. This one's for V.